Welcome to You and Your Pets. I'm Jim Horton. We're here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and a special guest tonight. And Dr. Rogers, would you present our special guest to us?
We're very fortunate to have Dr. Mark Lowenthal. Dr. Lowenthal is a psychologist here in Maplewood and happens to have a very beautiful little pet called Percy that I'm fortunate enough to take care of. Dr. Lowenthal works with children and adults, and we've had him here to talk about some of the issues that occur between pets, children, and adults.
Okay, and what is the particular focus of your practice?
I do see the range of ages. I see a lot of children, adolescents, and young adults, but I also do work with families and even couples at times. So I have a pretty general practice.
Okay.
In Maplewood.
And what is the difference between treatment with a psychologist and treatment with a psychiatrist? How do you actually practice that's different?
Psychologists are generally doing psychotherapy and working with individuals or families in weekly psychotherapy, trying to address problems. Psychiatrists in this day and age are more likely to be doing evaluations and prescribing medication. So, that's not always been the case, but that's been more true in recent years.
Would it be fair to say that a psychologist does talking therapy, whereas a psychiatrist does medical therapy?
I guess you could call it that. I mean, I think that, medication has become the largest part of the psychiatric profession in this day and age. But they also do evaluations and diagnostic work as well.
Well, let's get more focused. Let's talk about the human-animal bond. What can you tell us about that?
Well, it's the connection between humans and animals and the dynamic relationship.
It's interesting. I think I see maybe more of that in veterinary medicine from the animal side. And it just seems interesting that the human-animal bond is one in which, and I'm sure Dr. Lowenthal will agree, it's one in which there's a relationship between a pet or an animal and a person. And that relationship can be positive, it can be negative, it can be passive. And it's just a very interesting dynamic that we're starting to recognize just since the mid-90s.
So, if we look at the human-animal bond, when do you see it actually starting in your practice? Do you see it starting with someone that's before they're pre-verbal? Is it something not until they're 5, 6, or 7? Or is it just something that's natural? What exactly is it?
I mean, it's an interesting question, and I'm not sure I have the definitive answer, but I do feel like young children obviously react to animals from a very young age, and I think often before they can speak. And kids react very differently. Some are just so drawn to animals, and others...
some are terrified.
Exactly.
Right.
I think that it really... And it does evolve and it changes over time, but, I think it seems like it's very much part of most...
Being a human.
Yeah.
Part of being a human, we find that, if you look back at any time period, you'll find that animals have been part of our society. And so the human-animal bond is something that's great. You have pets, you have a bond with your pet. You have pets, you have a bond with your pets. I have many patients and many pets, but quite frankly, you develop a bond with each of them, some of them good and some of them bad. The human-animal bond is one thing that is dynamic, I think I have to say. Dynamic in the space of a relationship between a person and an animal. It can be very different for different people and different animals.
So, what are the pressing issues in dealing with the human-animal bond? What are the things that, as a psychologist, that you actually see that come up in your practice?
Well, something that I think is very interesting is how beneficial connecting to animals can be for human beings in general. I think that, there's a study from University of Pennsylvania back in 1980 that spoke to the fact that having a connection with an animal can have tremendous physiological effects on the human being. We can help reduce the characteristics related to stress. So it can reduce blood pressure, can reduce respiratory rate,
cortisol
levels, decrease anxiety. So there's a lot of benefits for human beings to be connected to animals.
I'm aware of animal therapy done particularly with the elderly, but is animal therapy done as well with the young?
It's definitely done with the young. I think, and there's a number of medical institutions. I know at Hackensack University Medical Center, they have a large animal therapy program, and they work with the cancer patients in the pediatric cancer ward and a number of the different medical units, and also in psychiatric work. There's a lot of that going on, more and more.
Does it make a difference of the type of animal? I mean, we think dog and cat, but what about hamster and goldfish, or a turtle, or something like
Or
that?
chickens.
Or chickens.
Right.
I mean, does in your experience, does the human-animal bond vary? I mean, a youngster and a horse, for example, must be a very close bond, but
And there are people that consider themselves equine therapists. I mean, that's an area that I think is...
Hippotherapy.
But I mean-
Hippotherapy, is that what it's called? Yeah. Okay.
But a youngster and a donkey might not be as much of a. I mean, is there a variation, or is it a cultural variation that we're talking about?
It's not an area of expertise of mine, so I
Right.
can't speak to that. But
I think there's likely, at least what I've seen, there's likely to be a positive, beneficial relationship between people and animals. I think different people, if you come from an urban setting or if you come from a rural setting, your perception of animals can be very different. The rural person might see cattle as meat on the table and not as a pet, whereas the urban person would go out and see cattle as a threat. The suburban person might well see cattle as, well, I'm going to become a vegetarian because they have eyes and tails and they, so I think it's a perspective of your family, it's a perspective of where you live, it's a perspective of how you've been brought up as to what kind of relationship you have with different animals. I think Dr. Lowenthal was telling me before we started that there was a positive benefit for one of his patients or one of the people he knew with chickens. Do you want to relate that?
well, it's particularly interesting because this kid, I think, has struggled a little bit with the siblings and in school. Young child, he's in kindergarten, but he lives in a rural area, and his family got chickens recently, and he's amazing with the chickens, and he relates to the chickens in a way that he's had trouble relating, to his peers. So, and it's really helped him, I think, to feel better about himself and to give him a sense of responsibility. He takes tremendous responsibility for these chickens, although, in other areas he's still struggling.
Right.
It's interesting.
It's interesting. We promised our daughter when she was 5 that she could get her first puppy, the same dog we still have, if she took care of it. That was the stipulation. Of course, she didn't take care of it. We ended up taking care of it, but she still has a almost mystical bond with the animal, and it's been 13, 14 years now, and it hasn't changed in that whole time period.
I think there's an interesting aspect to this, and that might be, as Dr. Lowenthal was mentioning before, the aspect of, I want to get a dog, and the parent saying, well, now, that might not work out, and you just spoke to that issue. That's a great segue. Would you like to speak to that issue?
Well, it's definitely
Causing
one of the issues that I see in my practice with, kids bugging their parents for long periods of time sometimes about getting a dog, getting a pet. The parents being concerned that it's a lot of responsibility and, are you going to take responsibility? And it's often becomes an issue later because the kids, of course, say yes. And they mean to, they intend to at the time. But, the reality is, depending on the age, how realistic is it for them to take, that much responsibility? So, you have to negotiate those kind of things. And that pet is, it's often a lot of work. It's often not exactly what they imagine. It's not like in the movies necessarily. And so, working those things out and helping the kids deal with sometimes the disappointment that they might feel if, depending on the pet or if the pet seems to be more drawn to somebody else in the family, a sibling or even one of the parents, can create all kinds of issues.
So what exactly, or how exactly does a pet help in the social and psychological development of a child?
Well, one of the things that I think is so important is because I think kids tend to identify with their pets, and I think that identification can be very beneficial because it helps them to develop a sense of empathy, and they sort of feel for their pets, and sometimes they're more able to be empathic with their pets than they're able to be empathic with other people, especially with really young children. But that sense of compassion and empathy for their pet can really be very, very helpful in terms of them just developing into a caring human being.
What though, and this inevitably happens with every pet, the pet gets sick and the stress level of the child goes, in my observation, goes way up. Is that a negative, or is that just a normal part of development that sooner or later a child has to learn?
I think it's like a member of the family, so it's the same. It would be similar if somebody in the family got sick, and sometimes, and sometimes even more so because they are so connected with that pet, and the pet doesn't want to play, or the pet's, obviously not, behaving the way it normally does. It can be very difficult, but it is part of life, and I think that, you try to help the kid through that the same way you would with any other kind of stressor. So I don't see it as a negative, but it can be very difficult.
So how do pets help us cope with daily stress? I mean, you come home, if you've had a bad day at the office, you come home and they say, come home and kick the dog. Well, no, that's not what you really do. So what,
It isn't?
but how, I mean, is the animal, psychologically, is the animal really that much of a stress reliever, or does it depend on the bond between the...
I think it does depend on the bond, but I think they can be a source of unconditional love, which I think is one of the reasons why so many of us love having our pets around. I think that they're non-judgmental, so they love you every morning, whether you yelled at them the night before, or whether they're forgiving. It just seems like they really are just such good, supports, I think.
They don't complain when you come home late.
Right,
they don't complain if you don't bring home a meal. They don't complain if you haven't taken a shower last night.
Well, ours complains if you don't feed him at the table.
Yeah.
But that's...
But I think that source of unconditional love and that relationship that is a bond that takes a lot of negativity to break, I think most dogs will always come back no matter what happens. And I think that's a positive thing.
The physical affection that, some animals really crave is also really very, I think, can be very therapeutic for the giver of that affection, and they can be so affectionate. I mean, every morning my dog will lick, me in the face, and it's just feels great. It's like you just...
Right.
We've got to take a break.
Okay.
And we will be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets with Dr. Ernest Rogers of the Maplewood Animal Hospital. And Dr. Rogers, would you take over and carry on the next section with Dr. Mark Lowenthal, please?
Thank you very much. I think I'd like to have the second half of the program and discuss some of the problems that I have, or some of the issues. We don't call them issues, we call them problems, we call them issues or challenges. Some of the challenges I have in my practice when I have to deal with things that present a psychological challenge to some of my clients. One of the big things is euthanasia. We often have animals that come in that are sick or having metabolic issues that they are not going to recover from. Sometimes they're in distress, sometimes they're in pain. and dealing with both adults and children. I don't know, I have been explaining to them that, look, it's better for the animal and all the rest, but the grieving process starts when I acknowledge that this animal doesn't have much of a future and that we're likely to have to put it to sleep. Any words of wisdom for dealing with that kind of thing, how to bring it to a better issue?
Well, I think one of the most important things is just to try to prepare the child, and that starts before they come to the office. I mean, I think that, you know, it's usually pretty clear when a dog is, or a cat or any animal is getting to the point that it might not be able to be around a lot longer. And I think trying to help the child just understand that none of us want that animal to suffer is critical. You know, I also think you have to be careful about, you know, how old you let a child be part of that process in terms of being, you know, witness to it. I mean, really young children probably would be better off not being
Really
there.
young being 2, 3, 5?
Yeah, I think under 8, I think that's probably better that they're not there for that process. I just think it's just so difficult and difficult potentially to understand. You know, the other issue that I think is really important is, you know, we often make use of the expression putting an animal to sleep. That's not an expression that you would want
Right.
to use with a young child, because I think you'd be better off trying to talk about just a painless method of
Saying goodbye.
saying goodbye and relieving the suffering, because you don't want to induce fears about going to sleep and
Right,
is
right,
something going to happen to
right.
me, or if somebody else, you know, is asleep. It's not a good term, even though it's something that we all do.
Right, right.
Does a young child really understand the concept of death?
Real young children have a very hard time with that, and I think that it's part of the reason why, you know, just the whole process of grieving is difficult, because kids under, you know, 2 or 3 don't really understand death generally, and even kids that are, you know, under 7 have trouble with the idea of the permanence of death. So it's really, it is a hard concept to grasp, and it's partly why, you know, after the death of an animal, of a pet, you really want to try to help, you know, reassure them, but also help them sort of resume, you know, sort of the routines that they're comfortable with, their life, because, you know, they're going to be aware of all the stress and anxiety around them.
And Fido is no longer there. Where is Fido? Those are the questions you have to answer.
And it's difficult because they may, you know, a little bit older kids particularly, I think, often will ask repeatedly, and, you know, they're not just trying to be annoying. I mean, they're really trying to put wrap their heads around it, because it is hard to grasp these concepts.
What about replacing a pet that has been put to sleep, or that goes away, replacing it immediately? Does that work, or is that just out of the...
You know, it's something that some people want to do because they want to fill that void, but it's generally not the best approach, because you really don't give the child or the adults an opportunity to mourn, you know, to grieve the loss.
The other problem with that, as I've seen, is you have a German Shepherd, the German Shepherd passes, you get another German Shepherd. Well, the second German Shepherd isn't what the first one was, and he becomes a negative influence in the house. People say, he's not as good as the other one, he doesn't know. Well, a 6-month-old puppy isn't going to be able to chase a ball and when you hide it. So that becomes an issue when you try and replace an animal. Mm-hmm. Animals, like people, are individuals, and it'd be difficult for me to replace my mother, no matter who my father married. So I think that becomes an issue. Another issue that comes up with the death of a pet is grieving. Mm-hmm. And in my perspective, what I've seen is that this is an opportunity for parents, in particular, to help their children learn a good process of grieving and how to come out of it, so that they aren't teenagers and lose their first girlfriend, not to death, but just lose their first girlfriend and go crazy. And we've discussed this previously on the show. Do you have any thoughts on that?
No, I think it's a good point, and I think, you know, the loss of a pet is often the first loss a child might experience. So it really is an opportunity to deal with that, and you know, to help them to be able to go through a process which, you know, is going to involve different feelings, and is going to not always be supported by their peers. I mean, I think that's one of the hardest things about losing an animal, is that losing a pet, is that it may be a tremendous loss for you and something that you are really devastated by, but some people, especially people that maybe haven't had that kind of experience, are not going to necessarily be that understanding of, and they may minimize it. It was just a cat, or
Right.
and that can be very, very hard, that they just feel like no one gets them. And that's even true with teenagers, I think, sometimes feel that.
Do you think there's a place for religion or rituals of a type in the loss of a pet? I mean, we don't often think of, a lot of people will go out in their backyard and bury their goldfish or bury their guinea pig and have a little saying for them. Do you see that as being helpful for people who are religious or spiritual, to use that type of thing to help?
I think it might be helpful even for people that aren't religious, because I think those kinds of rituals really help us to do something with our feelings. I mean, also projects can be very helpful. Just collecting photographs of,
Right.
of your pet, making some kind of album, talking about it, sort of even a eulogy of sorts.
Right.
I think can be
Right.
really a helpful process for kids and for adults.
Right. Well, if we could move on a little bit, I have another issue that comes up in my office sometimes, where the pet is coming in for vaccinations, and the mother or the father comes in with 2 children or 3 children, and the children are being crazy, as they always are in the vet's office. And it really doesn't bother me. I can work with kids, I can work with children. It doesn't really matter, the kids, as long as they don't hurt themselves, I'm perfectly happy. But the mother or the father, the parent often, or guardian often gets upset and says, "Look, you sit down now or I'm going to have the doctor give you a needle." It puts a negative perspective on us as doctors, but also it seems to me to be a situation that shouldn't happen that way. So what would you suggest in terms of, not necessarily discipline, but in terms of working with children in the office? Do you have ways for parents or even me to help in that situation?
I mean, that would be a tough situation, because you sort of want to just, shake your finger at that parent at that moment. I don't know that I have the answer for that.
You don't
one.
have the definitive
I don't
answer
have
for
the
me?
definitive
Well, I'm
answer.
not paying you.
But, I do think you want to help the parents understand, too, that it's important that not only their pet feel comfortable, but their kids feel comfortable with you, and not to fear you, and because they're going to need you, and you don't want them to sort of worry about every time they go, or every time their dog or cat has to go. So I would have maybe pull them aside at some point, but
Yeah,
definitely
right,
talk to them about
right.
that.
And so with all these things happening with pets, I mean, we see that pets are now the expense of pets takes away from the family in a lot of situations, and pets demand attention. Pets have to be walked. They have to be taken care of. How do you fit a pet's rituals or a pet's needs into the overall fabric of a family? How does that help the family, and how does that help the children?
Well, I think one of the important things is expectations, and I think right from the beginning, before you even, if you're getting a new pet for your family, I think you really do want to talk with the kids about what's involved as best you can. I mean, I had not had a dog prior to when we bought, Percy 2.5 years ago, and so I wasn't so sure myself, but from reading some of the books, and we tried to talk about what's realistic to expect, how much work it is, and the fact that especially with a puppy or a kitten, they're not always going to behave, they're not always going to listen, and just to set up realistic expectations, also in terms of how often they need to go out. And you need to be realistic about
Right.
what your kids really can do, what can they handle.
That seems to be, to some degree, cultural. I know when I grew up, I was in 4-H, and I was raising baby sheep, lambs, and at a very young age, and you had to bottle feed them twice a day, and you had to clean the stall twice a day, and that was just absolutely expected. You did that, no questions asked. And the parent didn't step in to do it for you either. My father was pretty stern on that score. But it really comes down to what the parents lay down as expectations, doesn't it?
I mean, I think that's true, but I think it's potentially unrealistic to expect that your young child is going to remember that, on this particular afternoon, your schedule is such that he's supposed to make sure the dog. I think you can have the expectations. I think the problem is they're not always going to be met, and you don't want the pet to suffer, and that's I think part of the concern. You're responsible for that animal.
Right. As an adult,
As
you're
an adult,
responsible.
right.
So, given the fact that we all have pets, I had a little bit different introduction to pets as a child. My mom said she had a mop for me when I peed and a mop for the pet. So I sort of was brought into a family of pets. Just quickly, how would you introduce a pet to a family, given that they've agreed as to the nature of the pet, the kind of pet, they want to have it, they've agreed on the distribution. How do you then introduce a pet to your children, for instance? Is that a difficult question?
I think that, again, you want to educate them as best you can. You want to educate yourselves. I think you want to make sure they've had exposure to pets. I mean, something I have seen in my practice is families that brought in a puppy. It was a puppy like a Doberman or something that the kids had not really had that much contact with dogs. And the son, who was about 3 years old, was terrified and liked him on TV, but had not really spent a lot of time around dogs, and it was pretty traumatic. So that did not work out. That did not work out well. So I think that expectations are important, and even once you get the pet, I think you want to include the children as much as possible in going through the rituals with them, having them to see what you're doing, bringing them to puppy classes whenever possible, so that they can really hear for themselves, what is the right way to handle the dog or the cat, and to learn.
Excellent. I think that makes my job a lot easier as a veterinarian when people are well oriented into their pets and the pets are well oriented into the family. I think we're getting close.
We're just about out of time. So I want to thank you, Dr. Mark Lowenthal, and of course, once again, thank you to Dr. Rogers. And this has been You and Your Pets, and with Dr. Rogers, our resident expert from the Maplewood Animal Hospital. Thank you for watching.